Now to another issue that is affecting us locally. Nationwide, the flu season has been a major problem, especially during the last week of the year. According to the California Department of Public Health, in the state alone, 8 people died from the flu between Christmas and New Year's Day. Today, Stanislaus County health officials tells us a person has died due to the flu. This is the first flu-related death of someone under the age of 65 in the county this season. Now joining us to talk to us about how the flu is affecting us locally is Leticia Berber with the Fresno County Department of Public Health. Welcome, Leticia. How are you today?
I'm doing well, thank you.
Thank you, Leticia. Leticia, first of all, we need to start talking about how is the flu affecting us here locally?
Here in Fresno County, we don't have any deaths being reported, which is a good sign, but we do have an increase. We had an increase of activity in our emergency departments over the weekend, meaning that people are showing up at the emergency department with influenza-like illnesses. We have reached a threshold of concern, meaning that those numbers that we have reached are a concern to the community because people are getting sick, people are being reporting to the emergency department sick with the flu.
And of course, what are those symptoms that people should be watching for?
Symptoms that people are showing up at the emergency department are cough, sore throat, fever, body aches, sneezing, coughing, and just feeling miserable, and that leads them to go to the emergency room. Right now, the public health department is advising people to get their flu vaccine. It's not too late to get your flu vaccine, and that is the best preventive method that we have. And again, the health department is all about prevention. We have immunizations, we have breastfeeding, we have eating healthy, and when it comes to influenza, we have the flu vaccine. Please get your flu vaccine as soon as it becomes available in your area. Right now, it's not too late to get your flu vaccine. Please go to your doctor's offices or come to the health department and get it for free.
And of course, people need to remember that you could get it for free at your department,
exactly.
right?
Yes.
Okay, where could they go to get it?
Yeah, 1221 Fulton Street. We have it for free. Just call for an appointment and we'll gladly help you. But please notify your doctors to see if they still have it. If they are offering it, go to your primary health department, your primary health doctor first.
And of course, how could people catch the flu?
Yeah, the virus is so easy to spread, especially right now during the holidays. Everybody's indoors. It's so cold outside. Nobody's going outside for walks like they usually do during the summer. So we tend to stay indoors. And that's when the virus takes the opportunity to spread so easily between family members. So that's why when somebody gets sick right now, everybody in the household will get sick. So please wash your hands constantly before and after eating, before and after using the bathroom, and touching any doorknob. Please wash your hands. Don't touch your nose, don't touch your face. Eat healthy. Stop smoking. If you're a smoker, this is the best time to stop smoking because your lungs are already damaged, and if you do catch the influenza, it can be a death sentence to you. So please keep that in mind. Also, your flu vaccine. We start giving the flu vaccine in September. It's still hot outside, 100-degree weather outside, and that's when we start giving the flu vaccine because we want people to get their flu vaccine before the season starts, which is in October. So right now, it seems like it's too late, but it's not. Please get your flu vaccine. It's not too late.
No, that's something that people should remember. And of course, we need to remind our viewers, how dangerous is the flu?
Flu can be very dangerous, especially for people who have asthma, any heart condition, or any other health where they're taking long-term medication, such as diabetes. Do take your flu vaccine if you do fall under those categories.
And of course, for those that already have it and they're suffering from the flu, what should they do right now?
Yeah, if you do come down with the flu, please stay home, especially if your children are to come down with the flu or any sickness. Don't send them to school. That prevents from the virus from being spread around. Stay home, rest, eat healthy, and just maintain yourself hydrated and stay in bed. Yes.
And of course, Leticia, we need to remind them of ways how to prevent it again. Because you said the vaccination, but what if people are against it? Like, what do you recommend for them to do?
If you do get your flu vaccine and you do become sick, again, the flu vaccine is not 100% effective. No vaccine is 100% effective. But if you do get your flu vaccine, that vaccine will help you from getting severe symptoms to where it leads you to go to the hospital. Wash your hands. Don't cover your cover your cough and your sneezes, and just stay away from small children, stay away from the people. Don't go to crowded areas, don't go to the movies, don't go to the mall when you're sick. Stay home.
And how long does that vaccine last whenever you get it?
That vaccine will last up to 6 to 12 months. So if you do get your flu vaccine today, right now in January, you're due for another vaccine in October. Remember, it's a flu season. Flu season starts at an odd time of the year, October all the way to May. So if you do get your flu vaccine right now, don't forget you'll need another one in October.
People need to just remember that 6 months to a year,
Yes,
right? That's
exactly.
how long it lasts.
Yes.
And of course, the flu is something that, people are talking about right now, but the measles is something that's it's affecting people.
That is another disease that's shown its ugly head here in California and throughout the whole entire nation, the measles vaccine. A lot of people here in California, and specific in certain areas, do away from getting their children vaccinated, which is a very dangerous step when it comes to preventing the measles. Measles is very contagious, very dangerous for children under the age of 12 months. Do get your measles vaccine. Again, we're all about prevention, and the measles is a horrible disease, especially for children, and adults can get it as well. It can be a horrible disease for adults, and it can spread very quickly. If we do have a measles case in Fresno County, it can potentially turn into an epidemic in measles if we don't stop it. So the public health department is here to prevent that and inform the community about the importance of vaccines.
Exactly, Leticia. We need to remind people, how dangerous are the measles?
Measles is very dangerous. It can lead to encephalitis, which is the inflammation of the brain, which can lead to death, or it can lead to any disability in that person that gets a measles. So it is very, very dangerous.
And how can you get it?
Yeah, measles spreads from person to person. Okay. So if you do get the measles, you'll get the measles if you're not vaccinated. So children, adults that are getting the measles right now, infected with measles, it's because they travel to an area where measles is endemic or it's going around in that area, and they come back to the United States infected with the measles. So that means that person did not get vaccinated. So that's how people are getting the measles vaccine, measles disease right now, because they travel to areas where they see a high number of cases of measles, and they come back to California, back to the United States, and then they spread the disease to children or other people that are not vaccinated.
Exactly. Yeah. And then for those who are looking for the vaccination, where could they get it?
They can go to their doctors. Usually the vaccine is administered at 12 and 15 months. Your doctor will give it to you during the physical exam of that child. If you missed your physical exam or if you need it for school, you can go to the health department and request the vaccine.
What if you're an adult, Leticia? Is it still
too late? Yeah, no, it's not too late. If you're an adult and you're in 30s, 40s and you're not sure, check with your doctor. And if you attended school in California, you probably had the measles vaccine because this is recommended to attend school here in the state of California.
Perfect. Leticia, thank you so much for being here today with us and that information.